Beijing BBA, so Beijing Kanatina, so Beijing Nihuye, so Beijing Hatulu, so Beijing We Latina, so Beijing Nebulo, so ya Nebulunkan, so be ya Nedegen, so ya Nebulunkan, so be ya Nedegen, so ya Nebulunkan, so be ya Nedegen. Suya, Subia, Subia.
Good morning, PSG. Good morning, everyone. You are all welcome to this year's annual AGSM of the Pediatric Society of Ghana, the second virtual section proudly being hosted by the Northern Region team. Today is the main conference day. We've had a wonderful 2-day period of pre-conference workshop. And if you have been part, you will agree with me that it has been an experience. Northern Region is delivering this AGSM in grand style. We will begin today's section, and I will call on Agsm to give us the opening prayer. Then we can continue with the rest of the program.
Okay, thank you, Dr. Please, can I be heard?
Yes.
All right. Please, shall we pray? Father, in the name of Jesus, we thank you for our dear lives. We thank you for a successful 2-day pre-conference. Father, once again today, we ask for your help for a very smooth presentation and discussion in the name of Jesus. Father, we ask that you help and bless our efforts towards this year's theme. And we ask that indeed you will help our babies to survive and to thrive. In Jesus' mighty name we pray. Amen.
Amen. Thank you, Dr. Agsm, for your prayer. This year's AGSM theme is Survive and Thrive, leveraging the opportunities from the COVID-19 pandemic to improve care of small and sick newborns. And we are proudly sponsored by our partners, WHO, UNICEF. We have Sanofi Pasteur, Novartis, AstraZeneca, Sesmix, and GE. They are helping us with this annual AGSM. And we are very grateful to all of them for putting their hands on deck so that together we can improve the care of children in Ghana. I will be your moderator or MC for today, and my colleague Yakubu Cosmos would assist me with moderating this program. Yakubu, if you are around, can we hear your voice? Or can we see you? All right. I'm sure as I look for my co-MC, we would want to continue with the program. I'll begin by introducing the chair for today's program. Give me a few seconds as all right, so the chairperson for today's program is Dr. John Eliza. He is an epidemiologist with 29 years of experience as a clinician and a public health specialist. He holds an MBCHB and an MPH from the University of Ghana Medical School, and I'm sure you all know that is a pioneer medical school in Ghana, and the School of Public Health. He has participated in several continuous development workshops and of international repute. He has done many contributory works for the WHO and in many countries, and has a number of publications to his name. He has a strong managerial and leadership skills and has occupied various positions as a result of this wonderful managerial and leadership skills. These include supervisor and trainer of 19 clusters during validation of maternal and neonatal tetanus elimination in Ghana, acting deputy director for public health in the Volta region, and acting regional director of health services in the Volta region, among many other experiences. But if I continue, we will not end now. However, currently, he is the Northern Regional Director of Health Services for the Ghana Health Service, a position he has held since 2018. So with a round of applause, please let's welcome our chairperson for today's section, Dr. John Eliza. Sir, please, if you are around, we would like to hear your welcome address, or we'd like to see you and welcome you virtually. Thank you, sir.
The president and the secretary of the Pediatric Society of Ghana, a representative of the UNICEF Ghana, a representative of WHO, a representative from Ghana Health Service Headquarters, the professional bodies present, the media, distinguished invited guests, ladies and gentlemen, all other protocol duly acknowledged. Good morning to you all. I bring you warm greetings and participation from the Northern Regional Health Directorate of the Ghana Health Service. Let me start by saying that the fact that I have been introduced as the chairman for this occasion indicates that I was contacted earlier on and I have accepted to play the role. I therefore feel very much honored to be given the unique opportunity of the Pediatric Society of Ghana. I thank the local organizing committee of the event for giving me this privilege. As a child health advocacy group committed to welfare and the interests of Ghanaian children, the Pediatric Society of Ghana, which is made up of health professionals drawn from various disciplines, teachers and members of the general public, that to be accorded great recognition and given commendation for pursuing the health needs of children in the country. Considering the fact that children are among the most vulnerable groups in our population that have special healthcare needs and require special attention. The call for collective and dedicated efforts purposely targeted at children should therefore be seen as something very laudable. The theme for this meeting, which looks at survive and thrive, leveraging opportunities from COVID-19 pandemic to improve care of small and sick newborn, is very relevant considering the times in which we find ourselves. In fact, our data still reveals that we still recording significant stillbirths and various health conditions and deaths among units, aside the myriad of health conditions our children operating. The situation, therefore, requires concerted effort to ensure that our children survive and thrive. The COVID-19 pandemic has introduced new dynamics into the health care delivery landscape, not only in Ghana, but across the globe. The pandemic has exposed the gaps and weaknesses in our health system, and this has challenged us to begin to do things differently. The new normal occasioned by COVID-19 has therefore presented us with some opportunities to think outside the box and critically re-examine our approach to doing things across the health system and our entire economic and social lives. An engagement like this annual general meeting and scientific meeting is necessary as it offers a platform to share ideas and experiences generated from our local interventions, research, and international best practices, so that we can rethink our approaches and adapt strategies that will give us better outcomes in our quest to get our children to survive and thrive. The multidisciplinary nature of the Pediatric Society of Ghana will also provide the enabling operational environment that fosters cross-fertilization of ideas from a wide range of background. And this underscores the fact that healthcare or health service delivery requires a multifaceted approach. It is my expectation that the knowledge shared in this year's AGM will find practical expression in improving care for the small and sick newborns in every district in the country. Let us together join hands to ensure that our small and sick newborns not only survive, but also thrive very well. On this note, ladies and gentlemen, let me once again say I have accepted the role to chair this function, and I appeal to the audience to support me to share it a successful end in order to justify the confidence the organizers put in me. At this juncture, I will gently hand over to the MC to continue steering the program as we listen to the presenters. Thank you for your attention.
Thank you very much, our chair for today, Dr. Eliza. And thank you very much for your opening remarks and your wonderful speech. Next on our agenda is for our host to welcome us to today's AGSM, or this year's AGSM. And the local organizing committee who have been doing this wonderful work is led by Dr. Al-Hassan Abdul Mumin, who is a senior lecturer with the University of Development Studies School of Medicine in Tamale. He also heads the Department of Pediatrics at the Tamale Teaching Hospital. And he's been a trainer of over more than 1,000 students or medical students. He has added so much to the medical profession. His influence in pediatric practice in the northern part of Ghana cannot be compared with any other. Ladies and gentlemen, let me welcome the one and only Dr. Al-Hassan Abdul Mumin to welcome us to this year's AGSM. Mumin.
Thank you so much, Mr. MC. I hope you can hear me well.
Yes.
Okay. Mr. Chairman, the President of the Pediatric Society of Ghana and NEC of PSG, kindly permit me to stand on the protocol that have been established to welcome you all on behalf of the local organizing committee for the 2022 AGSM of the Pediatric Society of Ghana. We are so glad that you have been able to register for this year's AGSM, and you have joined to contribute to the success of this meeting. Mr. Chairman, when we started the planning activities for this year's AGSM, our hope was that we will be able to deliver, even if partial, a hybrid conference that would allow for the members of the Pediatric Society of Ghana and our stakeholders and partners to meet in person and fraternize. This would have been after countless virtual meetings for almost 2 years now, since the pandemic was declared and Ghana had their its first cases of COVID-19. The other opportunity it would have offered us would have been for participants to see the beautiful scenes of Northern region and Northern Ghana. We have improvised part of it by playing the videos for those of us who joined and who will be joining later. But the in-person meeting would have been a different experience. Despite this initial setbacks, the expert faculty that we put together devised very innovative ways to deliver the pre-conference workshops. One of them was the recording of the demonstration of spirometry, which we did on day 1. And the second one was the breakout sessions that we had during the ECD interpretation workshop yesterday. For many of the participants, I believe this was their first virtual breakout session. And this is a memory that they will probably take with them for a long time. Mr. Chairman, the workshops were deliberately spread over 2 days to allow for maximum participation, because we knew the 2 teams selected for the pre-conference workshop were both important. And by doing so, we actually had a very significant attendance. We had more than 400 participants over the 2 days of the pre-conference, which is a huge success for a virtual meeting. The Chairman, the theme for this year's AGSM reflects the pandemic world in which we have found ourselves and the effects of the COVID-19 pandemic, even if hidden, on the sick and small newborn. Although the pandemic has largely spared the newborn population, at least for the direct effects, we have all documented the numerous effects the pandemic has had on healthcare, and that indirect effect has not spared the newborn. The AGSM itself, which is starting today, will give participants the opportunity to deliberate on some of the challenges and the opportunities that the pandemic has presented us to be able to sustain the care that we provide to the small and sick newborn. We will also have the opportunity to deliberate on the quality of care standards from WHO that have been adapted for use in Ghana. Mr. Chairman, abstract presentations have become a central part of the AGSM for the Pediatric Society of Ghana, and this year was no exception. We received numerous abstracts from various authors in different parts of the country. A select number of them will be presented in the afternoon session of today's program. We are grateful to all the authors and contributors for their effort in making this AGSM a success. Mr. Chairman, we had a strong support from our sponsors and partners. Without them, the program wouldn't have been a success. Their contributions meant that we were able to deliver this conference for our participants at virtually no cost to the participants. We are very grateful especially to our traditional partners, WHO and UNICEF, for their continual partnership and support. We are also grateful to all the sponsors, i.e. Sanofi, AstraZeneca, Novartis, GE Healthcare, and Sysmex. We thank them for keeping faith with us, even for a virtual meeting of this nature. Finally, Mr. Chairman, the local organizing committee's contributions to this program has been immense. This is in addition to the huge support that we have received from the National Executive Committee of PSG. I would like to use this platform to say a very big thank you. They actually deserve a larger applause, but we are doing this on a virtual platform. So probably virtual thumbs up wouldn't be a bad idea. But we are grateful for all the contributions of the local organizing committee and the NEC on the success of this meeting. I believe that we will all enjoy the activities that we have put together for this AGSM. And I hope and pray that come 2023, we will be able to meet in person for the AGSM 2023. I thank you all so much for your attention and stay safe. Thank you.
Thank you, Chair LOC, Dr. Alhassan Abdul Mumin, for your wonderful welcome address. And we are very grateful to you and your team for this wonderful EGSM so far. Next, we will call on our father, the President of Pediatric Society of Ghana, to give his address to this year's EGSM. And for those of you who don't know, our president is Dr. John Eliza, and he is a senior specialist and a critical care specialist at the Komfanochi Teaching Hospital, Kumasi, Ghana. He's a graduate of the School of Medicine and Dentistry, KNUST, formerly called School of Medical Sciences, and completed his residence at CAP and pursued a subspecialty training in the Red Cross Memorial Hospital or Children's Hospital in South Africa, where he also had an MPhil. He was the first to establish a pediatric intensive care unit in Ghana, and he's currently the head of that unit. He's also an assistant secretary of the Africa Sepsis Alliance and a board member of the World Federation of Pediatric Intensive and Critical Care Societies. In fact, he's served on so many boards and organizations, and he's also a member of the WHO Rapid Guidance Development Group, producing living guidance on COVID-19 therapeutics interim clinical management guidance and COVID-19 chest imaging guidance. In fact, when the COVID broke out, WHO took him away from us and kept him to work for the whole world. So he's also the former lead of the WHO Africa Regional Office, case management, COVID-19 case management team. Dr. John Eliza is the president of Pediatric Society of Ghana, and let's welcome him to give us his remarks. Boss, you are welcome.
Thank you very much, MC, for your generosity. Good morning to all who have managed to join us. We anticipate that more people will be joining. Mr. Chairman, Dr. Eliza John, Regional Director, Health Service Northern Region. UNICEF Country Representative, WHO Country Representative, GHS, Ghana Health Service Director, members of Pediatric Society, our senior colleagues, past executives, and all invited guests. It's a pleasure, and I'm excited to be here this morning and also to be giving this opening remarks. For this year's AGSM, we have carefully looked at what is happening around us and what is going on. As at yesterday, almost 388 million people have been afflicted by COVID-19. And out of this, sadly, almost 6 million people have died directly related to COVID. Outside that, we know that COVID will have collateral damage with all-cause mortality, not directly related to COVID, but others which, in fact, we think also will impact the pediatric population. Our major concern is how to get around this, how to improve care. Looking at what is happening, we think that we have a great opportunity this year to take advantage of improvement in health services across board. And as a result of that, we've taken and dedicated this year as looking at what opportunities as Pediatric Society, as members of Pediatric Society, as healthcare workers managing children, how can we take advantage of the opportunities, forgetting about the negative aspect of COVID and improve healthcare services. We know resources are being distributed. Government is investing in the health services. What can we do to draw attention to the pediatric side? And this is our role, this is our responsibility. We highlight this throughout the year to ensure that the process will benefit us also. Having said that, it is not only about structures, it's not only about physical structures, but we also look at the processes and how things can be improved. That is the reason why last year we partnered WHO to produce standards of care guidance for Ghana. And I am happy to say that the society worked day and night with Ghana Health Service and also WHO to ensure that we produce this. Our goal, another goal this year, is to ensure that this is well disseminated, because we believe that improving quality of care will ensure improved outcome. If we doubt this, what we know is that almost 50% of all poor outcomes in hospitals are contributed by poor quality of care. So it is our responsibility to ensure that this produced guidance is well spread and also actually shared among our members to use it to practice. And we also believe that if we stick to quality care, even if we don't have the resources, our outcomes will be much better with the little resources we have. With this, we are looking forward to a very successful meeting today and then tomorrow for our business meeting. We, on behalf of the society and members, I'd like to thank all our partners, especially WHO, UNICEF, Ghana Health Services, who have stood by us in difficult times, in times that we didn't know where to turn to. They have been with us. And we assure you, especially our international partners, that we are going to continue to be a reliable implementing partner in your policies and in your project. And please do not forget us whenever it comes to the pediatric population. We are looking forward to continuous engagement with our partners also from industry and pharma, because without you, our services will not be complete. Thank you very much. And then let me acknowledge the members here and thank you for all your massive support and in joining our activities. Thank you, MC, and take over from me.
Thank you, Mr. President, Dr. John Adebi Appiah, for your message. We will take fraternal messages from our other professional bodies who are here with us on the platform and who we work with daily in the care of children. So let's take the fraternal messages from our sister organizations. Can we get the messages from our sister organizations?
Ladies and gentlemen, all protocols duly observed. I bring you greetings from the National Executive Council, the National Executive Committee, and the entire membership of the Ghana Medical Association. I am indeed honored as the president of the Ghana Medical Association to be invited to be part of this important event, the AGSM of the Pediatric Society of Ghana.
Sorry for the technical hit. I'm sure my IT team is working behind the scenes to sort this one out as quickly as possible. So kindly hold on for them.
Ladies and gentlemen, all protocols duly observed. I bring you greetings from the National Executive Council, the National Executive Committee, and the entire membership of the Ghana Medical. Ladies and gentlemen, all protocols duly observed. I bring you greetings from the National Executive. Gentlemen, all protocols duly observed. I bring you greetings from the National Executive Council, the National Executive Committee, and the entire membership of the Ghana Medical Association. I am indeed honored as the president of the Ghana Medical Association to be invited to be part of this important event, the AGSM of the Pediatric Society of Ghana. As a member of the society, I am proud to have been invited to give a fraternal message. The theme for the conference is very appropriate for the times that we find ourselves in, and I quote, leveraging the opportunities of COVID-19 pandemic to improve care of the small and sick newborns, unquote. COVID-19, despite the challenges, has also brought various innovations within the health sector. It has emphasized the need to be self-sufficient and also have taught us to do things with what we have. In this light, I know that the conference will come out with some of the opportunities that the pandemic has afforded us and how we can leverage on these opportunities to ensure that we improve the care of our small and sick newborns. Sadly, newborn care in the country is one of the most neglected aspects of our healthcare. Lack of adequate funding, lack of critical equipment like incubators and phototherapy machines, inadequate numbers of trained personnel to manage sick newborns across the country are some of the challenges that abound as far as caring of the newborns is concerned. These have led to high rates of preventable deaths and long-term disabilities. Having noted some of these serious challenges in the health sector, my team of executives and I have decided to intervene in these areas, especially the care of the newborns. The GMA, as part of our Drive to Rebrand, has decided to leverage on the association's influence and network to provide incubators and phototherapy machines to some deprived hospitals in Ghana as a key initiative. This will ensure that at least these facilities are able to save some of the newborns that are usually lost or the ones that suffer serious disabilities due to lack of these basic equipments. In this regard, we'll be working closely with the society, and we call on all members of the society to support us to achieve this noble objective. It is my hope that by the end of the conference will come out with some proposals that will give clear guidelines as far as the best practices in improving care and outcomes for small newborns is concerned. We call on our members to partner the Ghana Medical Association as we
Okay, I think we would move on with the program and then come back to our other organizations that have sent us their fraternal messages. So the next on our agenda is a keynote address. And our keynote speaker for the day is Runa S. Shekti. Please, if I do not pronounce your name well, please pardon me. I'm a child. I'm still learning how to talk. So he is a senior public health strategist with over 20 years of demonstrated experience of working in low and middle income countries across Asia and Africa on health systems strengthening in complex and fragile environments, with special focus on building sustainable, equitable, and gender-responsive solutions for governments on delivering quality healthcare through targeted investment using a data-driven approach and innovations in areas of skilling healthcare providers, rational deployment of human resource, and digital innovation in service delivery and performance management. In 2019, as Chief of Health and Nutrition for UNICEF Ghana, Runa is leading the support the government of Ghana to achieve its SDGs by providing technical assistance in the areas of immunization, including cold chain strengthening, pediatric HIV, environmental health, quality of care, malnutrition, health systems resilience and emergency response preparedness, health financing, and COVID-19. Morona is a trained clinician with an MD in dermatology, venereology, and leprology, and a master's degree, has a master's degree in public health from India. He has 6 peer-reviewed publications and has served on various technical public health committees for policy and guideline development. He is our keynote speaker for today. And sir, you are invited to give your keynote address. Thank you. I'm informed our keynote speaker is getting ready to address us. So we will continue with our messages and then we will come back to him when he's ready. IT team, please, can you give us the messages, please?
Hello, dear Pediatric Society of Ghana. I bring you special greetings on behalf of our National Executive Board and the entire membership of the Society of Obstetricians and Gynecologists of Ghana, SOGOG, your closest sister organization and society that has always worked hard to keep you in business. I bring you congratulations on your HUSM once again, as you take time to focus on how we can all leverage the opportunities that the COVID-19 pandemic brings to improve the care of our small and sick newborns. As obstetricians, we've been deeply concerned by the negative effects of the COVID-19 on our pregnant women, resulting in preterm deliveries as well as preeclampsias, which also sometimes would compel us to end the pregnancies before term. And we are happy to also have influenced national policy, which has culminated eventually in the rollout of the vaccine to cover pregnant and breastfeeding mothers. Hopefully, this will help in the primary prevention of infection, of severe infection in our pregnant women. As you deliberate on how further to leverage these opportunities to enhance our response to pregnancy and COVID-19, it's our fervent wish that you have a very fruitful deliberation that ultimately improves the care and outcome of this our smallest newborns. We wish you all the best and we remain with you in this together. Thank you.
Do we have the message from the Ghana Registered Nurses and Midwives Association? Okay, sorry about the technical hitches. That is what happens sometimes when we are dealing with the technology. I'm sure if you were all gathered in the northern region of Ghana, enjoying the beautiful scenes and the environment, you wouldn't have had these technical challenges. So it comes with the doing things virtually. I'm sure my IT team is working to put things together. Is my co-MC around now? People want to hear your voice and see you. If you are around, can we hear you? Dr. Yakubu Cosmos.
Yes, good morning, everybody. Sorry for not being on earlier. I have been down with a little illness, and I've had to let my co-MC do all the work. Now I'm on. I'm having some few challenges with my network, but I hope things will stabilize. Thank you all very much and enjoy the program.
Thank you, Dr. Yakubu. Dr. Yakubu is a fellow of the West African College of Physicians and senior specialist of the Tamale Teaching Hospital and head of the emergency unit. Okay, so we'll take the message from Ghana.
Everyone, I bring you special greetings from the National Council of the Ghana Registered Nurses and Midwives Association. It's an honor and a privilege for us to join you today as you mark another milestone in the society. And the theme you have chosen for this AGM, we want to say that it is apt. COVID-19 has taught us a lot of lessons, a lot in the sense of healthcare and how we have to be prepared for pandemics or epidemics in the future. Taking care of very vulnerable, sick children and infants is of utmost importance to everyone, especially those of us in the health sector. And for us as nurses and midwives, caring for such babies is very important in the sense that they need special care. And taking the lessons of the pandemic in terms of equipping ourselves with the requisite knowledge and skills to be prepared at any point in time for any epidemics or pandemics requires that we also prepare adequately to care for our patients and our clients with non-communicable diseases. And I think that as we all work together and share ideas in this AGM, we'll be much better prepared in terms of what we need to know in caring for our infants and our toddlers and our children with jaundice and other conditions. So on this note, we want to wish you well in this AGM and want to assure you that the Ghana Registered Nurses and Midwives Association will continue to partner you in terms of delivering health services to these very vulnerable patients and clients. I wish you well.
Thank you, Ghana Registered Nurses and Midwives Association, for your message. We are most grateful. We will move on with with the conference for now. And next on our agenda, we have our partners, UNICEF, Ghana Health Service, and WHO, who will deliver some messages, followed up by dissemination of the standards of care and a message from our sponsors, and then our keynote address. So these are the rest of activities that we have. I encourage you to hold on as we sort out all the technical issues behind the scenes and deliver this AGSM virtually to you at the comfort of your home and your offices. Next, we will take our messages from Ghana Health Service, our host partner, or our home partner, our mother and father here in Ghana. So the representative of the Ghana Health Service, please, if you are on board, please, we are ready for your message.
Good morning to you all, and it's my pleasure to be addressing the AGSM for Pediatric Society this morning. Mr. Chairman, the Regional Director of Health Services, Dr. Eliza for Northern Region, Dr. John Eliza, President of the Pediatric Society of Ghana, our representatives from UNICEF and WHO. I bring you greetings from Ghana Health Service, in particular from the Family Health Division. And I'd like to add my voice to the congratulatory messages to the Pediatric Society for holding this AGSM, and in fact for playing the role of a strong advocate and technical support for child health issues in the country over the years. I am really delighted about the theme for the AGSM this year, because it is in line with the current National Child Health Strategy and Action Plan, which is focusing on newborns and their survival, but going beyond survival to thriving. Over the past almost decade, together with the society, we have worked to improve newborn survival, and a lot has been done. And now we are at a point where we need to go higher, because as they survive, we want them to also thrive. And so the focus of our current strategy is on improving care at the higher level facilities to offer care to the small and sick newborns. And that is why I'm happy that the society is also placing this in the limelight. I also want to thank the society for assisting in adapting the WHO standards for newborn and pediatric care in Ghana. That process has brought to fore the yawning gaps that we have in our service delivery. We have all agreed to good and high standards of care in these documents that will be shared soon. And challenging as it may look, I know that if we continue to forge the partnerships that we have forged with the Pediatric Society and other societies and professional bodies, we will be able to meet those high standards. As we go ahead, I'd like to urge us to continue to commit to disseminating these guidelines. That will help us get the needed support and get the necessary stakeholders to join hands with us to address these gaps. I know we can also count on you for strong advocacy to ensure the provision of the needs, the necessary infrastructure, the equipment, human resources, and other resources that are necessary to be able to adhere to these standards. One of the key lessons we have learned in this pandemic is the fact that monitoring key performance indicators is essential in recognizing declines in utilization, and I'll also add that declines in standards. Recognizing these early enough to be able to make a response and intervene. As we look ahead towards implementing the standards that we've all put together, I'd like to urge the society and all its members nationwide to be interested in looking at the data that we churn out. Most of the time, we are so busy with the clinical work that we don't pay the needed attention to the indicators that we are churning out. If we do, we will be able to know how we are doing and intervene appropriately. This is one key lesson that we learned as a service, because when we looked at our data at the beginning of the pandemic, we were able to detect that things were not going right, and therefore put together guidelines to rectify the situation, and that paid off. And so let's carry this key lesson with us. In closing, I once again want to thank you and say that let's continue our advocacy so that the good work that we have done so far will pay off, and we will all see a decline in neonatal mortality and an improvement in child survival as a whole. Thank you for your audience.
Thank you very much, our own mother, Dr. Isabella Segomoses, always present with us at the AGSM and always supporting us. Dr. Yakubu, what do we have next?
We will be hearing next from a representative of one of the organizations that has been at the forefront of global health. In the advent of the COVID-19 pandemic, the World Health Organization has been at the forefront of directing the world in combating this pandemic. We'll be having Dr. Doe from the World Health Organization address us next. Dr. Doe, you are welcome and you have the floor. Dr. Doe, if you can hear me, you have the floor.
Thank you very much, Mr. MC. Thank you very much. Please, am I audible?
Yes.
Great. Thank you so much. And thanks to the organizers of the meeting for having us on board. I bring you greetings from the country representative for the World Health Organization, Dr. Francis Kasolo. He says to send his congratulatory message to the Pediatric Society of Ghana for the consistency in organizing these annual general scientific and meetings. Mr. Chairman, Dr. Isabella Segumoses, representing the Ghana Health Service, representative of UNICEF, the president and executives of the Pediatric Society. Once again, on my own behalf, I say warm greetings. We really want to congratulate the Pediatric Society of Ghana for the leadership that you have played in creating awareness and for the advocacy around issues of the newborn and the child as a whole. We particularly appreciate your technical expertise in leading the various aspects of newborn health. In the past year, I noted with delight the number of activities that were carried out by the Pediatric Society, including the Prematurity Day. And looking at this year's theme for the AGSM, focusing on the small and sick newborn, I thought I needed to highlight that and also say thank you very much for all the various activities that were carried out on that day. WHO continues to commit to support the Pediatric Society and the country as a whole as far as newborn health is concerned. I think we've heard quite a bit of statistics on the impact of COVID. And if we zoom into the newborn, globally, we have about 7,000 deaths, neonatal deaths occurring every single day. Annually, this comes to about 5.3 million under 5 mortalities and 2.5 million neonatal deaths. Out of these neonatal deaths, about 30% occurs within the first day and 75% within the first week of birth. If we disaggregate the neonatal figures down further, we realize that the greater majority are within the small and sick group. And so this focus on the small and sick newborn during this AGSM, I believe is very appropriate and very apt. And as Dr. Segumoses said, very much in line with the strategies and the policies and objectives of the country as far as newborn health is concerned this year. In public health emergencies like COVID, as we had it, or we are still going through, sometimes the worst hit people, which are the vulnerable group, can easily be neglected, especially when we come to the newborn, because they are the small ones. But as we know, there's a need to focus special attention on them because they are the most vulnerable. If we look at the causes of newborn deaths within the pandemic, the main causes did not really change because as we know, the infection rate in the newborns was quite low. But the indirect causes of death from the fact that a lot of attention was focused on the response to the COVID was very high. And the key causes of death, infection, prematurity, etc., were still the leading causes in mortality for as far as the newborn is concerned. COVID has taught us that there's a need to have plans and resources and strategies in place before an emergency strikes. Because in the midst of an emergency, there's a high tendency to forget about the little ones and concentrate on the big issues in quotes or the big adults. But we know that the newborns are the most vulnerable and they must receive the most attention in such times. WHO has therefore come out with a lot of guidance documents to support countries in this direction. Specifically to the COVID pandemic, there were a number of guidance documents that were produced in relation to newborn care in the midst of COVID, breastfeeding, and these were always updated as the evidence unfolded. But generally, to secure the care of the newborn, to secure the care of the sick and the small neonates, WHO has come up with some guidance documents. I think the President, Dr. Adebi, has already mentioned that. And we are very delighted that the Pediatric Society partnered with the Ghana Health Service in the country adaptation of these documents from WHO. The aim is to standardize the inpatient care of small and sick newborns and to build on the essential newborn care that we have been doing. The guidance document also will serve as a guide for policymakers as we plan and we deliver on our healthcare services. Dr. Segumoses mentioned infrastructural inputs, etc. When we know the standard of care, what should be given, I believe that will be a good guide as we develop our facilities and put our infrastructure together. I know there's going to be a session where we'll have some experts share the standards with us, so I don't want to go too much into that. But ultimately, the goal is to achieve universal health coverage and to make sure that no group of people or population, including the small and the sick newborn, are left out. I want to once again commend the Pediatric Society of Ghana for their leadership in the process. And we really count on you to lead the way in the implementation of these standards across the country. We continue to commit our support to the society and then to Ghana Health Service and the ministry as a whole, as we together work to make sure that all newborns survive and thrive and achieve their full potential that God has given them. Thank you very much, and I wish us all the best in the rest of the sessions and in our deliberations. Thank you.
Thank you very much, Dr. Rosalindo, for your address. And to the audience, I would like to add that Dr. Rosalindo is an obstetrics and gynecology specialist. She's a member of the Pediatric Society of Ghana and has never missed our AGSMs. So we thank you very much for addressing us today, and we hope that in the future you will continue to join us whenever we meet to discuss child health. Thank you so very much. We'll be taking a break after this to help us update our settings so that more people can join the meeting. Please bear with us as we quickly do that.
Okay, so for the information of all, in fact, we had over 600 people registering for the AGSM. Unfortunately, we have less than 90 on the platform now. I think we have some systems challenge, and so we are taking a short break, maximum 5 minutes, but actually it's going to take 2 minutes. We will go off and sign in again. So those of you who have the link, please stand by and sign in again after 2 minutes, so that in 5 minutes time, we can continue with the section. Let me take it again. Because of the system challenge we are having, we will have to go off the system for 2 minutes, and then we all come back again. So after 2 minutes, please sign on again, because we have a lot of people who have registered and are having challenges to join the system. So we have to reconfigure things. Please pardon us as we take this short break. During the time, please take time to stretch your hands and legs and move around. Take maybe some tea or coffee and come back in 2 minutes time. Thank you very much.